Module 3, Safety Considerations. For the personal privacy of our peer educators, they are clothed in camisoles during the demonstration of each exam technique. During this module, you will learn about the best practices for safety of both the patient and technologist when performing a mammogram or other breast imaging procedures. First, let's address the safety of your patient. In working with any patient, asking your patient questions and actively listening to their answers will assure patient safety. Generally, most patients with a disability are aware of the best way to work with their physical limitations. Safety questions specific to mammography include obtaining information regarding the following: correct patient identification. As with all medical exams, it is important to verify that the correct exam is performed on the correct patient. For some patients with disabilities, this will require that the patient or the person assisting the patient is able to verify the necessary information. History of recent mammography. It is important to perform only the necessary imaging so as not to result in unnecessary radiation exposure. Potential pregnancy. Do not assume that your patient cannot be pregnant because she has a disability. Presence of breast implants. Again, do not assume absence of breast implants because your patient has a disability. The FDA requires documentation of presence or absence of breast implants in all patients. This is important to assure proper positioning of the breast as well as reduce risk of possible rupture if an implant is present. There are certain additional questions you should ask when working with a patient with a disability, including questions about mobility restrictions or functional limitations. Make sure not to move or ask a patient to move in a way that could cause discomfort or injury. For example, though a patient may arrive with a cane or walker, do not assume they are able to stand the length of the required time to obtain the mammogram. Assistive technology. Your patient may be using assistive technology, including mobility or communication devices. For wheelchairs, the patient should be considered the expert on what their chair can and cannot do. Ask the patient before touching or manipulating their assistive technology in any way. It is important to ensure that patient is physically stable and to prevent injury to the patient and her assistive devices at all times. Before and during the exam, make sure to communicate positioning strategies to the patient.
I'm going to turn this sideways, all right? Now, can we put your feet in front of the machine? Can we turn your... Okay.
Most of us tend to be more familiar with standard manual wheelchairs, their brakes, maneuverability, frame adjustments, etc. However, there are many different models of both standard and power wheelchairs. Speak with your patient to determine if arms and foot pedals are able to be removed or positioned around the mammography equipment, location and functioning of the brakes, ability to tilt, raise, or lower the seat of the wheelchair. Use caution when moving the imaging equipment to avoid injury to the patient as well as damage to their assistive device. After you and the patient have positioned their wheelchair and the mammography equipment, but prior to positioning the breast and applying compression, make sure to lock the wheelchair brakes. If it is a power wheelchair, turn off the power as well. When the exam is finished, make sure to return the wheelchair to its original configuration. The United States Access Board, an independent federal agency which develops and maintains design criteria to assure accessibility for people with disabilities, set final rule for medical diagnostic equipment in February 2017. These standards contain minimum technical accessibility criteria for examination tables, chairs, weight scales, mammography, and other imaging equipment. According to the U.S. Access Board Advisory Committee report, mammography is considered a specialized imaging study that involves complex interactions between moving parts of the equipment. Therefore, current equipment is to be manufactured to allow proper positioning for all women, including women with disabilities. Such considerations include the following. The breast platform needs to go low enough to accommodate a woman in a seated position. Positioning supports must provide enough flexibility for all patients to reach and hold them, providing stability for the patients during the exam. Knee and toe clearance must be adequate to allow a woman to get close enough, including when seated in a wheelchair. Base support of the unit must be low enough for wheelchair footrests to ride over it. If you were unable to perform the mammography or alternative imaging exam with the patient in her wheelchair, consider transferring your patient to a cardiac chair or gurney. Although general guidelines and description of transfer techniques are provided, all technologists and staff should follow their facility, hospital policy, and procedures for safe patient transfers. Personnel should be appropriately trained by their current facility or hospital in proper transfer techniques and patient safety. If performing or assisting with a patient transfer, it is important to do so with professional manner and skill and to handle the patient with care and respect. In addition to ensuring the patient's safety, the technologist must also take care to prevent injury to herself during the exam process, including working with the patient's assistive technology, operating and positioning imaging equipment, transferring a patient, and moving around the patient and equipment however necessary to get the image. Common causes of injury to the technologist include frequent repetitive motions, reaching arms above shoulders, stooping, bending, twisting, excessive wrist flexion or deviation, moving patients without proper technique.
As a technologist, it's very important to maintain body ergonomics. However, we all know as a technologist, it's always about getting the right shot, and we don't typically think of our body. We're not using our abdominal muscles. We're just doing what we can. We'll get down on our knees, we'll bend over. We're not thinking of our shoulders and the wear and tear that it's constantly being used.
Basic tips for ensuring technologist safety include, but are not limited to, determining your patient's mobility and weight-bearing limitations, obtaining assistance when needed, positioning yourself with a wide, strong base of support for stability, holding your patient's center of gravity close to your own for optimal mechanical advantage, using transfer aids according to training, lifting with your legs, avoiding bending your back, avoid trunk twisting while performing exams or patient transfers, always communicating with patient during transfer to avoid falls. Within the ARRT Code of Ethics, the technologist uses equipment and accessories, employs techniques and procedures, performs services in accordance with an accepted standard of practice, and demonstrates expertise in minimizing radiation exposure to the patient, self, and other members of the healthcare team. There is a fine balance between obtaining optimal images and limiting radiation exposure. Therefore, it is important that the technologist plan the imaging approach to limit the exam to only those views necessary, which may require oversight by the interpreting radiologist. The technologist should conduct all examinations with concern for patient dose and following ALARA principles. In the next module, you will examine the craniocaudal positioning and its modifications.